Can you tell us what we're looking at in this model and how this works, how our menstruation works?
Okay, well, this is a picture of the uterus, and you can see in the middle, sort of the empty space is the uterine cavity, and that's where the lining of the womb proliferates and each month grows. And if you don't conceive and a pregnancy does not grow inside the cavity, then hormones will fade out and you'll shed that lining, and that's the menstrual period. So, and you can see on the sides there are tubes and ovaries. The pearl white structures are the ovaries, and they're the ones making the hormones that generate the lining to grow, stabilize it, and if they have a little follicle, or it's a little sac that has an egg in it each month. And the whole purpose of the menstrual period and cycle is to grow a lining. Once that sac releases that egg, that little sac then makes hormones to make the lining grow appropriately for a pregnancy. That little sac or follicle, we call it a corpus luteum, it lives about 11 to 14 days making this hormone. If you don't get pregnant, those hormones die down. It triggers the menstrual cycle, the menstrual lining to shed, and you get your period.
Now, how soon or how early should we expect a young girl to get her period?
The average age is 12, but believe it or not, they consider even 8, as early as 8, normal, but most times at that age, you're still short, and we know that in height, and we know that once you start making estrogen, starts to help the bone epiphyses, we call it, to close. So if we see someone get their period too early, we do have mechanisms and medications to prevent them from having that happen, so they'll get to a normal height. So it's not common to see it, but they actually consider it within the normal age. But average age is about 12.